Step into a world where the line between healing and horror was impossibly thin, a time when a simple cut could be a death sentence, and the doctor's bag was often more a harbinger of doom than a promise of relief. Forget the romanticized images of heroic cowboys and daring pioneers. Today, we're digging deep into the truly gruesome, often untold reality of Old West medical practices. Prepare yourselves, because what you're about to hear will make you profoundly grateful for modern medicine. The American frontier was a place of unparalleled challenge and danger. Life was cheap and suffering was abundant. But perhaps nowhere was this grim truth more starkly evident than in the realm of healthcare. When you consider the vast, untamed expanses, the isolation of settlements, and the sheer lack of scientific understanding, it becomes chillingly clear why disease and injury often held the ultimate dominion over life and death. Imagine you're living in a dusty, remote town, hundreds of miles from anything resembling civilization. You've just witnessed a saloon brawl, and a man lies bleeding from a gunshot wound. Who do you call? There were no emergency services, no well-equipped hospitals, and certainly no paramedics. More often than not, your best hope, and frequently your only hope, was a traveling doctor, a figure who might have been a failed prospector, a disgraced preacher, or perhaps someone who simply owned a medical textbook and declared themselves an expert. Formal medical education was a luxury, a rarity, and often a sham. Many who claimed to be physicians had no more training than what they'd gleaned from an apprenticeship or a few months at a diploma mill. Their knowledge of human anatomy was rudimentary, their understanding of disease causes was virtually non-existent, and their surgical skills, well, they were usually a testament to brute force and speed, rather than precision or sterility. This brings us to the invisible killer that stalked every injury and illness: infection. The concept of germs was still in its infancy, largely unknown and certainly not widely accepted on the frontier. Surgeons would operate with unwashed hands, instruments wiped on their blood-stained aprons, moving from one patient to the next, unknowingly ferrying death on their fingertips. Sawdust-covered floors, communal bedding in makeshift clinics, and stagnant water sources were breeding grounds for bacteria and viruses. A simple laceration from a fall, a scrape from a wagon wheel, or an insect bite could quickly fester into gangrene, demanding amputation or leading to a agonizing death by sepsis. It wasn't just the visible wounds that killed. It was the unseen army of microscopic invaders, allowed free rein in a world utterly oblivious to their existence. Now let's talk about surgery, a word that, in the context of the Old West, should send shivers down your spine. Picture this: a patient, perhaps a miner with a crushed leg or a cowboy with a bullet lodged in his abdomen, lying on a rough wooden table in a dimly lit room. Anesthesia, as we know it, was a pipe dream. Sometimes a patient might be given a stiff shot of whiskey, a swig of laudanum, an opium tincture, or simply a wooden block to bite down on. The surgeon, often without assistance, would then begin his grim work. Amputations were common, often necessary to prevent the spread of gangrene. The process was horrifyingly swift and brutal, with no sterile field, no pain, relief and crude instruments, sometimes just a carpenter's saw and a butcher's knife. The limb would be severed, the blood vessels tied off with unsterilized thread, and the stump cauterized with a hot iron ore left to heal naturally. The screams were deafening, the outcome often fatal, not from the initial trauma but from the inevitable infection that followed. Bullet removal was another common, harrowing procedure. A bullet, especially a lead one, could carry fragments of clothing, dirt, and bacteria deep into the flesh, leading to sepsis. The surgeon would probe for the projectile with unsterilized fingers or instruments, often widening the wound and causing further damage, all while the patient writhed in agony. If the bullet was too deep or too difficult to extract, it might be left in place, a constant source of pain and potential infection, or a grim souvenir of a life-threatening encounter. The notion of delicate, precise surgery was an alien concept. It was about getting the job done quickly and with minimal fuss, regardless of the patient's suffering or the long-term consequences. Pain management was rudimentary, bordering on non-existent. Beyond alcohol and opium, there were few options. Opium, in various forms like laudanum, was readily available and widely used, often leading to addiction. It offered temporary relief from excruciating pain, but did nothing to address the underlying cause. For the vast majority of aches, pains, and chronic conditions, Individuals simply endured. They relied on their own resilience, the fleeting comfort of a bottle, or the dubious promises of patent medicines. The stoicism often associated with frontier life was less a cultural choice and more a desperate coping mechanism in a world where constant physical discomfort was the norm. Life on the frontier wasn't just about dealing with injuries. It was a constant battle against disease. Epidemics were rampant and devastating. Cholera, dysentery, smallpox, typhoid, and tuberculosis swept through settlements with terrifying efficiency, often wiping out entire families or decimating small towns. Without understanding how these diseases spread through contaminated water, poor sanitation, or airborne particles, attempts to combat them were largely futile. Quarantines were often poorly enforced, if at all. Treatments ranged from ineffective to downright dangerous, including bloodletting, purgatives, and bizarre concoctions of herbs and minerals. Smallpox, in particular, left a trail of disfigurement and death, with what little immunity existed often being gained through surviving the disease itself. This desperate search for cures opened the door wide for charlatans and snake oil salesmen. These smooth-talking peddlers traveled from town to town, selling miracle elixirs and patent medicines that promised to cure everything from consumption and rheumatism to baldness and impotence. These concoctions were often little more than alcohol, opium, cocaine, or even mercury mixed with various herbs and dyes. While they might offer temporary relief due to the intoxicating or narcotic ingredients, they rarely cured anything and often caused more harm than good, leading to addiction or poisoning. Yet, in a world devoid of effective alternatives, these brightly labeled bottles represented a sliver of hope, preying on the desperation and ignorance of the suffering. Women on the frontier faced their own unique and particularly grim medical challenges, especially concerning childbirth. Pregnancy and delivery were incredibly dangerous endeavors. Without access to trained midwives or doctors, and with little understanding of sterile practices, maternal and infant mortality rates were astronomically high. Puerperal fever, an infection contracted during or after childbirth, was a silent killer. Hemorrhages, difficult births, and complications like eclampsia often meant a tragic end for both mother and child. Women were often forced to rely on the limited knowledge of female relatives or neighbors, whose good intentions could not overcome the severe lack of medical understanding and sanitary conditions. The miracle of life was often shadowed by the very real threat of death. Dental care? Forget about it. A toothache in the Old West was an agonizing ordeal, often leading to infection that could spread to the jaw or even the brain, proving fatal. Your dentist might be the local blacksmith, handy with a pair of pliers, or perhaps a barber. Extractions were performed without anesthetic, with the patient enduring excruciating pain as the offending tooth was wrenched from its socket. Broken jaws, further infections, and lifelong pain were common consequences. Maintaining oral hygiene was a luxury few could afford, and the effects of poor diet and lack of care meant that most adults suffered from chronic dental problems. Even mental health was a terrifying frontier. Little was understood about conditions like depression, anxiety, or psychosis. Individuals suffering from mental illness were often ostracized, confined to crude asylums, or simply left to fend for themselves. Misinterpreted as demon-possessed or simply crazy, there was no therapy, no medication, and certainly no empathy for conditions that were beyond the comprehension of the era. The suffering was profound and often lifelong, with no hope of true understanding or relief. The reality of Old West medical practices was a testament to human resilience in the face of overwhelming odds. It was a time when the most common medical advice might be to grin and bear it, when every illness was a gamble, and every injury a potential death sentence. The pioneers, cowboys, miners, and settlers who braved the frontier not only faced the dangers of nature and outlaws, but also the terrifying reality of a medical landscape that was, by today's standards, truly barbaric. It's a stark reminder of how far medical science has come, how precious our modern advancements truly are, and how many lives were lost, not to bullets or starvation, but to the simple, brutal fact of medical ignorance. So, the next time you visit a doctor, spare a thought for those who came before, enduring a gruesome reality that makes our worst nightmares seem tame. If you found this chilling glimpse into the macabre medical practices of the Old West as fascinating as it was disturbing, make sure to hit that like button, subscribe to our channel for more. untold truths and grim curiosities from history. And let us know in the comments what other dark corners of the past you'd like us to explore.